All right, welcome back. We've been having some really interesting discussion with Rabi and Aisha. So we've heard their stories. Now we want to talk about specific challenges and they've experienced from dealing with the hospitals, the healthcare professionals. Some of the things that you feel need to be pointed out, that you feel probably needs to be changed, because our healthcare professionals, in my opinion, nurses, doctors, physiotherapists, they need to be educated as well. This is a crisis. This is a nationwide problem. So let's start with you, Aisha. What some of the things that you've noticed in taking care of Saidu?
Actually, right now what he needs in his body is a whole lot of physiotherapy, because his joints, his body is not functioning, all that. But the problem is, when you go for physiotherapy, you notice that all these people, the physiotherapists, if they see a child like that, they get reluctant, like they don't want to, go there, maybe because they don't want to, get tired. I don't know. They don't really.
That they're afraid that they're going to hurt him more.
No, like they feel they're going to maybe get stressed out, exercising him. They don't, I don't know, they really don't know how to manage them very well. They don't want to, if they say, okay, this one is a sickler and his body is not functioning. Okay, no, I don't want to take care of this one. Maybe let me just go to that kid. He's standing, it's only his leg that's, had.
So they would, in your presence, they would say, no, they don't want to take care of this person?
No, yeah. Some would even do it in your presence.
Wow.
And some, the way they would behave, you definitely know, okay, they don't want to go there because he has a lot of issue.
Right.
And you're not the one who brought it upon yourself, you just want it.
Yeah, exactly. And that's
you're just an innocent baby,
That's sad.
Seriously,
sad.
I've experienced that a lot, because sometimes I take him to physiotherapy myself. So many times I've taken him.
And they just act that way?
Yes, they just act that way. Or maybe they're supposed to spend like 10 minutes or 20 minutes on him. They'll just do sharp.
Let him go.
I'm just letting go. Okay, let's go. Next person. And I think that's the.
That's good. Rabi, what are your experiences? I know you have a lot of experiences with regards to that. Both your own and emergency room.
Really terrible. ER in Nigeria is terrible. You can't just dash into an emergency as a sickle cell warrior and expect to get that treatment. I think maybe emergencies in Nigeria prefer to see people at a dying state, at a peak of death, before they attend to you. But if you are conscious and you tell them that you are in pain, I don't think it actually makes sense to them, which is one of the training that they should go through. I don't blame them, because I don't think we have doctors, experts in sickle cell. We only have GPs looking after sickle cell patients. So I think that's where the problem starts. And if you just have a GP that only knows sickle cell from what he has read in the books, he will really not understand,
So you tell me that when a patient comes in a crisis in the average Nigerian hospital,
they want to really see you, really deteriorated before they can.
They want to see you not talking and probably need oxygen and all that or something. So the first time it happened to me here in Nigeria, I was really upset. I even had to go to the print media, but I warned them. I said, the next time I do this, I'm going to publish the name of the hospital that did this to me, because I'm just the wrong person to do that.
What happened?
I walked in and I was in serious pain and crisis, and the nurse insisted that I had to see the doctor, and my mom was with me, and so we went into the doctor's room, and he was on the phone. He was chatting, maybe with his girlfriend or something. And he kept chatting and laughing to himself, and I was sitting on that chair
in front of him.
Yes. And sometimes when you have this pain, you don't want to talk too much. You can't even scream, at a point. You just sit down there and you're just waiting for help to come, no matter where the help is coming from. So he kept chatting, and my mom waited because she was trying to get a form or something. So when she didn't see me, she ran into the consulting room, and then she saw that he hadn't even attended to me.
How old were you then?
I was as an adult. I would say yes, 30. Yes.
Wow.
So I sat down there, I was looking at him, and then he was like, okay. And after that, he now dropped the phone. I said, okay, what can I do for you? And my mom looked at him, she glared at him and told me, stand up, let's go. And she gave him words of her mouth, and we left the hospital for another hospital. And then I came back when I was much better. And then I demanded to see the CMD, which I was not allowed to. Then I went to a print media and then reported the case. And then I brought a copy of what I wrote about them and told them that next time I'm going to write the name of the doctor and the hospital. And that was how one of the doctors apologized and all that. So twice, another time I was having that, and they left me there as well. They were running helter-skelter for something else. I begged them, I was like, I just need a painkiller, So what they should do with sickle cell patients is, no matter what you want to do, leave tests, leave everything. If the patient is conscious and is in serious pain, stabilize that patient first.
Put a line.
Yeah.
Yes?
Yes.
Then the patient will be able to communicate with you properly, and then you can start running tests. As long as the pain is still there, you're not getting anything from that patient, not even his name.
And one thing I noticed, one thing I noticed, right, is it's not just about the medication, right? Even the way you treat sicklers, there's this what we call emotional stress. When you go to the hospital and they're giving you attitude, they're doing that, they're doing this.
That
actually puts you off.
Yes.
You start to get depressed. Is it because I'm a sickler? That's why they're treating me like this.
Things like that.
Yeah.
So I think that's something that needs.
They really have to be trained.
In fact, in my
dealing
it's not all
with
about the
them.
medication.
Yes.
in my opinion, I really feel that part of continuous medical education, and in part of the core curricula in medical schools, nursing schools, physiotherapy school, is a whole class on sickle cell disease and multiple classes.
Special class
at every level.
Yes.
To teach them on how to deal with the sickle cell patient, disease patient. And one of the first things we say is you have to put in a line, you have to put in the fluids. When I say put in a line, I mean put in drip, and just have the fluids flowing. That's one of the easiest things one can do to manage and control a crisis, because part of it is because of the blood flow being blocked or obstructed. And so putting in fluids can help to dislodge that. But then pain reliever, understanding how to use pain reliever, antibiotics and all those things, those need to be a core part of what we're doing. So it's not a question of, we don't know what to do with this person. When they come in, they
want to run a malaria test for you
at
that point, and run it all the tests while you are in pain without doing anything.
And they know it
doesn't work that way.
It does make sense.
Yeah.
What I notice is, most of this hospital, I think they should, what I suggest, they should maybe have a section for sicklers.
I agree. So I agree with.
But you just see sicklers and people that are
everybody together.
Just.
I think that has brought up a really major point, which probably in our next session we will really go into some more, because that's part of policy and at a higher level kind of thing. So I just want to say a big thank you. It seems like our producers are already telling us time is gone. I don't know where time is going. I mean, just we're having something really important and interesting to talk about. So I just want to say thank you again for making it today. We're going to continue on next week, and hopefully we'll come up with even more interesting things to talk about.
Okay.
So folks, stay tuned. Sickle cell disease in Nigeria is extremely important. It's something that everybody at all levels, government, private, NGO levels, individual levels, need to get involved in. This is Nigeria. Nigeria is number one. There's no reason why there shouldn't be a concerted effort to deal with this condition in Nigeria. So speak to your constituencies, speak to your politicians, everybody concerned. Let's try and get this thing properly handled. God bless, and we'll see you next week.